I've enjoyed over the years in the meetings where you ask the good questions, and I keep thinking, how come I didn't ask that question? That's a good question. And so you're obviously very involved and very passionate. So what I'd like to start is, because as you know, I'm very passionate about what I do, whatever I do. What are you passionate about?
Well, again, some of the passion that I have nowadays is trying to figure out what's going on in the dental world and how to communicate that to our colleagues in a way that is, basically informative, entertaining, and helps them become better at what they do. There's so much going on out there. The dental profession has changed over the last 30 some odd years.
Just a little bit.
Tiny bit. Since
How
I
long
graduated.
have you been in practice, by the way?
I've been in practice since 1983. Graduated Northwestern University. And I live in a little community in upstate New York called Ithaca, New York.
Right.
And stumbled into that opportunity. It was kind of weird. I was in Chicago, my final year of dental school, and I didn't know what I was going to do and where I was going to go. I was going to stay in Chicago. I was going to go back east. What was I going to do? Because I grew up in Brooklyn, New York.
Okay.
This is a
I was gonna
fabulous
say, this
place.
isn't a Chicago accent.
No, this is not. This is actually a blended chameleon accent.
Okay.
No matter where I am, I seem to pick up the kind of the.
So now that you're in Southern California for 4 days, you're going to say groovy and dude.
No, I do that anyway.
Oh, okay. Just checking. 'Cause that's what we do too.
It's just amazing. I've had so many opportunities, and when I was at school, I was looking around, and at that time period, the recession had hit, the early 80s, and there were jobs unavailable anywhere. And I was thinking at that time period, maybe go to New England, go to Massachusetts or something, and set up practice there. Well, at that point in time, I like to say that New England was closed. They weren't letting anybody, and there was just no opportunities whatsoever. And so I started calling around at various things and talking to various dental supply company representatives to find out where possible places would be. And I somehow got into contact with a guy named Joe Koss from Syracuse, New York, who ran a company called Norton Star. And Joe was about 60 at the time, and one of the most remarkable individuals I've ever had the opportunity to meet. He came out to the Chicago Midwinter meeting and he said, "Meet me, we're going to go out for some drinks." We went out for some drinks and Joe drank me under the table. But he made a promise to me that he was going to find me a job somewhere in the central New York area. And I said, okay, sure, fine, no problem. Chicago Midwinter meeting came and went, finished up my work at school, got my license, and saying, what the heck am I going to do? And as at that time period, most of the guys in my class, there's always the group called the super seniors.
Right.
They had not quite enough credits to graduate, but they were close, and they needed to get just a few more cases done. So I would work in the lab and do lab work for them and stuff like that. And one day I was paged to the telephone. I says, I don't have any patients. I've graduated. I don't have anybody. I don't have any responsibilities here any longer. And the next thing I know, I pick up the telephone and Joe is screaming on the other end, "I've got you a job." I said, "What do you mean? Who is this?" He says, "It's Joe. How soon can you come out to Ithaca, New York?" I said, "Where the heck is Ithaca, New York?" He says, "Get out here. I need you in the next couple of days." Okay. Hung up the phone, contacted the travel agent, because at that time there was no internet access to anything like that. Got in touch with the travel agent, booked my flight to Ithaca, New York, flew in and interviewed with a wonderful senior doc, and he took me under his wing, and I had a job. I'm like, okay, that's cool.